It's Reality Check with Craig Price.
I'm an idiot.
4 minutes in and I'm already wrong.
I'm like a monkey. Hello, look at me. Craig, shut up.
Hey, I need you guys to do these things.
You're like a beautiful mind. I'm more like Forrest Gump. So it's Reality Check with Craig Price. This week, Dr. Craig Wiener is here to talk ADHD. Welcome to the show. Starting off, we've got some really good news. Thanks to you, our fine and learned listeners. Reality Check has been nominated for Best General Podcast from the Podcast Awards. If you haven't been following the tweets and the emails as of November 1st, the voting has been happening at podcastawards.com, and I need you to go there every day and vote once per day until the 15th of November. I know that's quite a commitment, but still, if you can do this for the next week and a half, that would be great. Please head over there now and every day until the 15th and vote for the podcast. We're up against some pretty large shows, so spread the word and get everyone you can to vote. Podcastawards.com, Best General Podcast. Vote once a day, every day until the 15th. But enough of that for now. Today we're talking about ADHD, which is Attention Deficit Hyperactivity Disorder. Now, many people claim to have it, and mostly it's self-diagnosed. It's a really nice, inclusive excuse to say, hey, I forgot this, or I'm distracted, or I'm absent-minded. So they just say I have ADHD. But, millions of people, especially children, suffer from actual ADHD. And it can be quite a problem. So Dr. Craig Wiener has a new therapy that works without medication, because medications have a tendency to wear off or not work long-term. And so he has a new therapy that allows parents to kind of take control of what's going on without medication. And we kind of went deep into parenting, which is an uncomfortable topic for me, as I am not a parent and have no plans to becoming one. So it got really weird because all I can do is go from observation, and quite frankly, what I see is not very good. But I'll let him tell you what's what. He's the doctor, so let's get right to it with Dr. Craig Wiener. So ADHD seems to be this big catchphrase that everybody kind of lumps any kid with any kind of behavior problem at all, even if he's just grumpy. So how do we know it's a grumpy kid with actual personality or mental health issues versus just a troubled kid who's just not paying attention, or he's just an average kid who just doesn't want to listen?
Well, it's whether they do all the behaviors that qualify them for the diagnosis, which is a manual that says if you did this behavior and this behavior with more frequently, with more intensity than other kids the same age, then you check off yes, they do. And if you get enough of these and there's disruptions in the person's life, like at school and at home, then they could qualify for the diagnosis. So a grumpy kid could also qualify for the diagnosis, but they may not do all the behaviors that are necessary to get the diagnosis.
So it sounds like they're using the label to get the diagnosis. Is that so they can get access to medication, or is it just so they can get access to... Because if it sounds like if it's such a wide range of people can get the diagnosis, why are they trying to diagnose a possibly regular child or who has no mental health issues, who's just grumpy, versus ADHD?
Well, I guess some people would want to get the diagnosis because it maybe gets them access to a prescription, but for the most part, these are kids. Well, in the case of children, these are kids who are struggling at school or having trouble at home, and people are trying to figure out how to help the child. And the diagnosis is really just a descriptive label, but people think it's an explanation for the behavior, which is, they're behaving this way because of this problem. But the diagnosis is really just a description of whether the child does these particular behaviors very frequently.
And it seems like this diagnosis is becoming much more prevalent, and I'm not sure if that is because, like autism, the range, or the spectrum as they call it, seems to get wider because the testing is getting better. Is that the same thing here, or is it just easier to lump kids into ADHD so we can just ship them off to whatever counseling or whatever they can do just to get that off their plate?
Well, that's a really great question because people make a lot of different explanations for why the more and more children are being diagnosed this way. Some people think we're just getting better at identifying kids who have problems. Other people are saying that, gee, the schools need a diagnosis to put the youngster on special ed or to have the test scores not count against certain kinds of data, which goes with federal funding. Other people feel like, well, if more people become familiar with these diagnoses, the more people see themselves in the diagnosis. So you start to explain problem behaviors in terms of the diagnoses that people hear about. So there's lots of different reasons why, but people are more and more getting all kinds of diagnoses. The number of diagnoses you can get are increasing. The book is getting thicker and thicker with each passing year.
And in speaking of book, we're here. My guest today is Dr. Craig Wiener. Your book, Parenting Your Child with ADHD, a no-nonsense guide for nurturing self-reliance and cooperation. And the crux of your book is that it is not a medical issue, so to speak. Like it can't be fixed with drugs. It's a behavioral problem.
Well, even the people who give the drugs aren't fixing the problem. They're saying if you give a youngster a stimulant, you can enhance their concentration and settle them down so that they're less chaotic in their behavior. I'm saying that, yeah, you can do that, but long term it doesn't seem to be working very well, and also you're always risking side effects with any medication. So I'm giving parents an option of how to help the youngsters stop doing these ADHD behaviors and start to do more cooperative behaviors and more self-reliant behaviors. So I wrote a parenting book that helps parents accomplish that.
Now, I'm not familiar with the actual taking of the drugs for the kids. I know there's Ritalin and Adderall and things like that. Now, are these prescribed because eventually there'll be improvement, or are these things like, with heart medication, you got to take, your pills for the rest of you got to take one pill a week for the rest of your life kind of situation?
Well, there's improvement as long as you're on the pill. If you go off the pill, you won't have the improvement. So that's one of the problems with the solution is, and then the other thing is if you take the drugs long enough, they did a study at Johns Hopkins, for example, they followed kids for 6 years, and they found that after 6 years, the kids that were on the meds were no different than the kids who never had any treatment, so that the meds stopped working with enough time passes. People know that about lots of drugs, that they work at first, and then either your body acclimates to it, or you get used to having it, or and then you have to get on a different drug or take more drugs. But even so, the long-term data isn't that great with these drugs, but they do remarkable things in the short term. And 80% of the people get significant improvements by taking ADHD medications.
But even if you weren't diagnosed with ADHD, taking these drugs for short periods of time would improve your focus. I know that college kids take Adderall for just that reason. They don't have ADHD, but they got a test, and so they take drugs to focus.
Well, very much so. The drugs affect everybody the same way. So that they did studies that show that kids on college campuses that are in fraternities and sororities, 8 out of 10 are using ADHD meds in terms of their studying, and so that there's a huge overuse of these things because they get a 15% performance boost.
If it's not necessarily drug related or chemically balanced, it's not a chemical imbalance where drugs will fix over the long term. You're saying that a lot of this is behavioral. So what kind of instances would a parent be able to identify the fact that they're creating a behavioral problem with their kids?
So I make the case that it's not really the parent creating it, because a lot of these kids are difficult to socialize right from the beginning. They're kids with negative infant temperaments or coordination problems, language problems, health problems. And these are kids, or high activity levels, and these are kids that create extra problems for parents to socialize them. So the parent now there's lots of kids with the diagnosis that don't have these additional hardships, but a lot of kids with the diagnosis have these other hardships that make them difficult to socialize. It makes it difficult for them to learn to be self-reliant, makes it difficult for them to coordinate. But I try to help parents see that the interactions that they have with the child can sometimes unwittingly reinforce the behaviors, which means get them to actually occur more often because the behaviors result in something that's advantageous for the child. For example, if the child's hyperactive and they get a lot of attention when they're hyperactive, then they learn to be loud and hyperactive. If they distracted and it gets them away from a situation where they feel like they're failing or they don't like what's being imposed on them, then the avoidance gets them away from the aversive situation, and that gets them to get reinforced to do avoidant behaviors. So then the problem is, how do you solve that? How do you get a kid to learn to do schoolwork, to have less avoidance responding to a schoolwork, for example, or to chores or to other things that the parents are expecting the child to do?
And if they're responding to negative response, like you said, the hyperactive kid, when they are hyperactive, they get attention. Is it they're looking for any reaction, or is it negative reactions get more stimulus to them? Like if they were ignored, they're going to stop doing the behavior. But are they purposely looking for that negative, or are they looking for positive reinforcement, but they'll settle for negative reinforcement?
Well, yeah, they probably might not even know they're doing it. They just do it. So it's like lots of things we do in life. We don't really know what the reinforcements are. Sometimes you sit down with a psychologist, they help you understand your own actions because you don't know it all the time. But these kids may, if the parent's on the phone, for example, the kid might have been playing quietly, and then they hear the parents on the phone, they start acting up. It gets the parent off the phone, whether it's jealousy or they don't like the idea that the parent's not readily available because the parent's busy with something else. So they're very situational. They're situational behaviors. And the child doesn't necessarily plan out, I'm going to act up, get the parent off the phone. They just start acting up. The parent gets off the phone. And then it repeats. The next time they want the parent to leave the antique store or something else, they start touching things and making a problem. And lo and behold, the parent and the family leave the store more quickly. So and no one knows that it's happening. It just kind of happens. And over time, all these things are very subtle, and the youngster just keeps learning what to do. If a youngster comes into a room with a bunch of adults and the adults start talking, the youngster learns. These are kids at 2 years old or a year and a half were already doing these behaviors in some way. They were learning if they put the thing in their mouth and everybody stopped what they were saying and went over and did something to get the kid to stop putting the toy in the mouth. So the kids learn very quickly what gets a response and what doesn't get a response. So it happens very early in life, all these behaviors.
Well, I can actually see how that can happen. I can relate to that as not in a negative way, but when I was a small child, my parents would have guests over or friends over, and I'd come over and I would try to make them laugh, and that reinforced the fact that I'll try to be funny as a not necessarily a defensive mechanism, but as an attention getter. Later on, it became a defensive mechanism where if someone was picking on me, I could turn it around to make them laugh. I could see how that could work in a good way, where it leads you on to becoming more outgoing, but I can also see how that could easily backfire rather quickly. So if it's all this subtle, nuanced behavior and adjustments, how can you one, recognize it so you can correct it, and then what are some steps that we can do to actually start correcting it?
Yeah, so, these are great questions you're asking, because in today's day and age, if you get these diagnoses and they're considered medical problems, and lots of people don't even go to psychologists anymore. They go to their pediatrician. The pediatrician says they qualify for the diagnosis, and they get a medicine. And the outcome is going to be not that great necessarily, long-term especially, because no one's sitting down and making sense of the person's history of living in the world. And I'm trying to help people study their interactions with each other and see how they're solving problems together and see what's getting reinforced. And then they can learn to solve problems differently or shape the child to do other behaviors instead of overreacting or avoiding or intruding. There's lots of things to teach a kid so they can learn to be more reasonable.
So do you suggest that, because I know most parents are going to go for the quick fix, and also the not necessarily the most popular, but the most common fix. I think parents want to do what's right, and they want to do what other parents are doing. So if other parents are going to the doctors and getting Ritalin, Adderall, whatever, parents, I think, feel guilty not doing that.
Exactly, and they're trying to help their kid. And the problem is in today's day and age, we have these views about what's going on with people, and a lot of it's medicalization of psychology. So I think it corresponded with the advent of so many medications and having the medical people involved with all these psychological patterns. The usual intervention is the medications, and then the parent is told the youngster is unable to self-manage because of this ADHD, gets them to just act without being able to self-manage. They have lesser control over their actions. So the parent's told to do more things to control the child. But then the child doesn't learn to self-manage because the parent's told to hover and direct the child's actions. And I'm actually taking the thing in a very different direction. I'm saying, how can you go about helping a child learn to self-manage? So I'm not saying they can't self-manage. I'm saying, well, how can we help them learn? And so I'm recommending a therapy that helps develop the child in that way.
So right away, even if you do go the medication route, it's very important in parallel to at least go to some psychological evaluation, some therapy as well, so you can correct the problem once the drugs finally wear off or no longer work.
Yeah, you could operate in that way too, exactly. But unfortunately, I think since the people view the ADHD as an inability to control oneself, then even the psychologists are recommending treatments that have this presumption that the child's defective or deficient or delayed, and therefore everybody's compensating. So instead of getting the child to learn the necessary behaviors, we're always compensating for something that's seen as missing for the child. So it takes even the psychological treatment in a different direction. Like I'm reluctant to have kids get rewards, parent orchestrated rewards and punishments, because then the kid doesn't learn to live in the world away from the parent. They only learn the behaviors because the parent says, well, if you do this, I'll give you this, or you get this extra thing. But the child's not learning to live in the world because the rest of the world's not going to give them an extra thing every time they do something. They have to learn to do it based on what happens in the world when you do it. So the child has to learn to do schoolwork without extra rewards. They have to learn that knowing things and cooperating is nice for the child. If the child has to learn the benefits of it for themselves rather than just because the parent's forcing it. They're going to take away the phone, or they're going to keep the kid's Nintendo game away from them. And it's a very coercive relationship. So you have to be very careful what the psychological intervention is going to be, because it could create other problems.
Because it's starting to remind me of how we train our dogs. Because you can't raise a kid like you're raising a dog, because my dog will go crazy for sausages, and if he does something good, we give him a sausage. But you can't walk around with snacks in your pocket with kids, because you're right, that's not how the world works. The world doesn't always give you a treat when things go well. So how can we start a plan to, because it's really difficult. I know parents nowadays feel so guilty when they have to punish a kid. They want the kids to like them. They want the kids to be happy, but they want the kids to actually like them as a person, not necessarily as a good parent. So they feel like if I punish him, they're gonna hate me, and then there's gonna be an issue. So they have to get past that guilt. Number one, how can they get past that and then start a regime where they can correct this behavior?
All right, so I try to get parents away from the idea that your punishment usually means I'm going to induce suffering, and then you'll learn because you're suffering. Now, I'll give you an example. If the kid's not being careful with things and breaking things, then the question is, you could say, if you break things, I'm going to take this away from you. And then the kid might not break things, or the kid may learn not to lie about what happened, or to sneak, or you could say, if we're careful with these things, we don't have to replace them. And then we have more money left over to do other things we might like as a family, so that the youngster can learn that there's an advantage to taking care of the family property, because it means that we have extra resources to do other things. So if you're so busy dealing with I'm going to make you suffer because you did this, then the youngster then you get into the issue, what if the kid didn't do it, now I'm punishing you? Or then the kid doesn't want to say what happened because they're afraid they're going to get punished. Or rather than just dealing with helping the child learn about the economy of the family and taking care of each other, there's other reasons to learn to do socially acceptable behaviors other than fear. Because we train each other with fear, you're going to get all sorts of side effects. So I'm developed a way to socialize a child with lesser fear and lesser coercion, But it doesn't mean there's no limits. The limits are firm and kind. It's still we can't do this. It's not safe. You still say no, but you just learn to do it in a very calm, assertive way. They don't have to be angry, and I don't have to punish you or make you afraid of me to get things to be solved.
Well, on the parent side, is there a technique that they can use? Because this is not easy to do, especially if you've been raised a certain way. If I was raised where, if you did something wrong, wait until your father got home, and then there was corporal punishment involved. I don't have kids, but I could see in my mind how a smack on the butt, not beating a child, but a smack on the butt could be effective. I don't think that's right. In my logical, reasonable brain, I know that is not right. That causes these negative effects in the long term. But in the short term, just because of instinct and the way I was raised, when I hear about it, my first impulse is, I can see how that could be. So how do we get out of these old traditional patterns of discipline into a more progressive, more logical, way of disciplining children?
Yeah, and that's the most difficult thing. Like what you're saying is that you do get the parent gets reinforced to do the coercive behavior because it works quickly. Like if the kid's tantruming, so you go to the kid and smack them, right? The kid will stop tantruming. If you smack them enough times, they may stop. Then the question is, what's the side effects of that? Now the kid learns to do that to other people because that's what was done to them, or they'll learn other behaviors even if they don't tantrum. That what's your relationship with the child going to be in terms of connection if you're a feared person? Now the other thing is, but the parent gets the tantrum to stop quickly. But what if you ignore a tantrum, for example, when possible? Then you don't know it worked until you notice the tantrums are less frequent later on. So you only know later on that your intervention worked. Life has to play itself out over time. So lots of parents see that this stuff starts to work so beautifully, but it takes a little time to start to notice it. Because you didn't give in to the kid that time, and the kid threw a tantrum. You didn't know if it worked or didn't work until later on. You notice the kid isn't doing the behavior so often. So I try to help parents see that it takes a little time to learn new routines and habits. And then the other thing is, if the parent has to kind of learn all these new ways of handling problems, so it's a learning process for the parent. So that's why I wrote a book to say, how can parents learn these new things so that they can help socialize their children in different ways?
Now, we talked about the negative things like, hitting a child and taking things away and making them suffer. How can we stop the reverse or the exact opposite of spoiling them or giving them treats all the time? How can we? Is there a good technique that will prevent us from always reinforcing and giving them rewards?
Yes, very much. It's another great question because in some ways that's one of a big factor in these ADHD behaviors is the amount of accommodation that is being done with these kids, so that if they act out and intrude and infringe and don't show responsibility, that the social group actually accommodates, gives them extra time, leaves quickly, helps a kid who's procrastinating at the last moment do all their work for them. So then I try to help parents try to figure out what happened in their life that's getting them to go to this opposite extreme, which is often an overcompensation if they felt they weren't recognized or accommodated to enough, or they were overly controlled. And with their kids, they're trying to make it so the kids don't suffer like they suffered, but they do the opposite extreme. So often doing this approach requires a parent to look at their own psychology and to understand what's getting them to have so much trouble with the child's disapproval or not accommodating to the child, or just sitting quietly if the child is uncomfortable for a while and not just giving in. What's so terrible? And we have to figure out what the parent's anxious about. So this thing takes a lot of self-discovery, and it takes some thinking for all the participants. It's not as easy as just controlling somebody or giving them a drug.
And I think that's the big problem, is that I think a lot of people think it's all going to be solved by science, quote unquote, medication. They'll come up with a magic pill and it'll all be taken care of. Now, one of the things is I'm not a parent, and I'm glad I'm not a parent for one main reason, because you can do a great job of raising your kids and you can teach them all kinds of great things, and then they have to go to school. And once they go to school, your kid is now bombarded by the bad parenting of all the other children. So they start learning things from their peer group, not necessarily from parents and taking the cues from, what works with their parents and what doesn't, but they start seeing behavior in other kids. Is there a way that we can teach them that, yeah, I know Jimmy is acting crazy and being mean and doing weird things. You don't have to be Jimmy. You can be yourself.
Yeah, so that's one of the things parents kind of are there to help the kid problem solve. Do you want to copy what Jimmy's doing? What happens to Jimmy when he acts that way, and what do you like about it, and what do you think the benefits of it would be, and what problems might happen if you act like that? And let the kid tell you. So, because if it comes from the child, it's more likely to own it and to then follow up when you're not around. That's one of the beauties of lesser coercive parenting, is that the youngster buys in and does it. So if you're not around, you're more likely to get better follow-through.
But is there a way that you can make sure? I mean, it's almost impossible to make sure that you do your best you can and then you send them off into the world.
Yeah.
But when you start seeing that they're being influenced by other kids, and because if you just sit them down, I know a lot of kids won't talk to their parents. So you ask them questions and they will be evasive or they will be indifferent. So they won't actually tell you the truth. They'll just say, no, I just like it, or I don't want to do this, or we're not, or they'll outright lie. Is there a way that is there things that you can notice with your child that they may be doing that, that if you ask them directly, it's not going to happen?
Yeah, so I talk about this. The one of the nice things about this kind of new parenting is that your child feels that it's safe to talk with you about how they feel and what they think, because you're not you're not threatening them with punishments and control. You're not a controller. You're a facilitator and somebody that's helping to guide them. So that you have an open. That's the whole point: is get a relationship where you talk with each other, so that the youngster feels free to share with you, and they can stay involved with their life that way. And the idea is that if you're training your child to be more assertive and to self-manage, when they see these other kids, they're going to be less insecure, less likely to follow along just because they want to be accepted, or follow along because they feel powerless. So what you're doing at home sets it up so that they may be less likely to just be a jellyfish with their peers and have more integrity. So you're training that all along beforehand. So when they go, they're more likely to be leaders or have integrity, to stick with what makes sense to them, even if other people would tease them. So that's the whole point, is that you're getting your kid to develop some behaviors that help them live in the world in a reasonable way.
And the sad part is when you see a reasonable kid, it's usually an anomaly in society. It's like, hey, that kid's well behaved. I wonder what their parents did wrong to make that kid so quiet. Like I know people who are considered shy, and they you should get medicated, but it's not to the point where they're adverse. It's not affecting them adversely. They just not as social as other people. And I think that when people are quiet and shy, it's seen as a negative sometimes, when it's just, they're just shyer than most people. And so I think a lot of times there's some kind of misdiagnosis. Parents want their kids to get along. I know my mom wishes my brother and I had a better relationship than we do, but that's just the way it is. And we're both healthy adults. So when you see your kid doing something that you wish they weren't doing, it can be quite painful. So is there like groups that the parents can go to, like support groups for parents as well? Not just parents go to the psychologist with their kids and learn some things, but is there some things that parents can do to help their own self deal with kids?
Yeah, they could find out what's going on in their area, or get on the internet and find out what parent groups are available to them, and then they can learn all sorts of things, like how do you help children who are fighting solve their conflicts, so that the sibling rivalry changes, because that could be related to lots of different things, like parent side taking, the parent overreacting to the fights, the parents role modeling the behaviors when they're not aware of it in their marital relationship. It could be that how the kids get the attention from the parent. So there's lots of subtle things that parents can learn to do with sibling conflict. and to figure out what that's all about. What are the reinforcements for the kids that are fighting, and why are they fighting the way they're fighting?
Well, I certainly appreciate your time. The book is Parenting Your Child with ADHD, a no-nonsense guide for nurturing self-reliance and cooperation. Dr. Craig, and I want to call you Dr. Craig because I'll edit this out, and my wife and my mother will both feel like I'm accomplished something. I really appreciate your time. Where can people find you if they want to learn more about the book, but also about what you're doing?
So I have a website. It's craigwiener.com. So and my last name is spelled Wiener. And if you just get on Google at Craig Wiener ADHD, you'll see that I have a website. And then on the website there'll be the links to all the major book distributors that sell the books, and you can read a little bit about what I'm doing. And there's also a contact Dr. Craig Wiener page where you can contact me.
Well, I certainly appreciate your time, and it's, I think I paid attention the entire time. I almost think. I think maybe there was at the beginning I almost lost it, but I paid attention the entire time. That's the show for this week. Thanks again to Dr. Craig for coming on the show. Don't forget, each and every day until the 15th, vote for Reality Check Best General Podcast at podcastawards.com. Tell your friends, tell your enemies, tell anyone who will vote. podcastawards.com. Best General Podcast. Do it right now. And as always, questions, comments, suggestions, go to Craig at speakercraigprice.com. See you next week.